So now that we're ready to draw our specimen, we go to our patient. We're obviously going to wash our hands, wash our gel, put our gloves on. Forgive me for using my daughter's baby doll. And you're going to position your baby to whatever side is more ergonomically suited for your body. And I'm just going to give you some tips and tricks. So ideally, you want the baby's body in a flat plane or the head higher than the heels. And then if I was going to do this baby's right foot, I would turn the baby on the left side. So if mom was breastfeeding in this side lying position, that's great. Now, if she were breastfeeding on the other side, I would just simply do the other foot. Or if baby was in bed, I'd roll them to the side. So from here, you want to make sure that when you're doing this, you have the rest of the baby swaddled or at the breast held by mom. But you would do a swaddle wrap that would just leave this limb out. From here, I'm going to wrap these 3 fingers down and around the shin. I'm going to use my pointer finger to come up over the heel, like the midpoint of the foot actually. So what I'm doing here is I'm providing support for the foot should it flex, and I'm holding the rest of the leg nice and stable. And then on the back side here, I'm using my thumb to just kind of gently massage the calf, and then I'm not squeezing. So what we want to avoid is really squeezing the limb, right? So what we should have done beforehand is really warmed the foot up ahead of time, putting a heel warmer. I like to put 1 heel warmer here and 1 on the calf, so 2, and then cover that in a diaper to keep that whole limb just nice and warm, maybe 10, 15 minutes before I'm ready to do my lab. So not a ton of time, but just enough time to get it nice and warm. Because we know perfusion decreases if we're cold. So avoiding a limb that's cold. And then once we're ready, we would clean, apply support, hold your finger over the kind of like the arch of the foot. And then when you poke, you're going to aim for those kind of the ideal spots are right where my thumbs are here. So never the very bottom of the foot and never up towards the Achilles, right? You can really cause nerve damage if you hit this flat on the bottom and too high up on the side. So it's really a very tight window of what is appropriate. So just about where the moons of my fingers touch the baby's heel is appropriate. So more to both lateral sides. And then again, holding in that supported position, not squeezing. So once we've applied the lancet, you wipe that first drop away, and then you can just kind of like give a gentle squeeze with your fingers, not squeezing down with the foot, but just more of like a massage, right? Letting the blood refill, and then giving it a little gentle massage squeeze, and then just support for the foot. You never want to see the foot bent to touching the shin, because these babies are new, they're super flexible, they could do that, which is why you need to have these fingers back here to really provide support.